The Stars and Stripes show is brought to you by the U.S. Embassy.
Well, it's Gabs FM, powered to engage your world. And of course, welcome back to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM. And of course, if you've just joined us, welcome to the show. And this is where we get to celebrate the bilateral relationship between the U.S. government and of course, the BW government. Now, listen up, Samantha, there's been an amazing launch of community clinics on wheels. I think this is definitely embracing the knowledge-based economy. This is definitely a partnership between both governments, showcasing the power of collaboration. And of course, the Minister of Health, Honorable Edwin Dikoloti, and the U.S. Ambassador to Botswana, His Excellency Howard Van Franken, officially launched the Community Clinic on Wheels on September the 28th, 2023 at the University of Botswana Business Faculty Amphitheater. The U.S. government, through funding from the United States Agency for International Development, otherwise known as USAID, and of course the U.S. President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, have procured 4 mobile clinics that will provide integrated healthcare service delivery during the outreach of the non-governmental clinical agencies. And of course, in the building, we have the honor of speaking to His Excellency, the Ambassador Howard Van Franken. Your Excellency, how are you?
I'm doing great. Dumalong, great to see you again, Swift.
Absolutely. And of course, we have none other than our very own Honorable, the Minister of Health, Honorable Re Edwin Dikoloti. Motsadi waka, welcome to the show.
Happy Independence Day.
Fantastic. And happy Independence Day to the two of you, okay? All right, moving swiftly along, pun intended. Mr. Ambassador, let's start the show with you. You know, thank you so much for, taking the time to always come by the Stars and Stripes radio show. And of course, you know, this is a momentous and a great achievement between both governments. Look, let's touch on your experience within your perspective of seeing the B-Dub and of course this momentous occasion that has just happened.
Really appreciate that, Swift. As I said, I'm delighted to be here with Dr. Dikoloti, the Honorable Minister of Health. Happy to be here in the blue, black, and white republic on the eve of this important holiday. Really delighted to be here in the B-Dub in the 267, and of course back in the studio here with you and Samantha, particularly when we can talk about and celebrate this momentous occasion. In the time that I've been here, it has inspired me to participate in so much good sort of public health activities, along with our partners in the Ministry of Health.
Absolutely, Sam.
Wow, that sounds fascinating, your ambassador. This brings us right to the core of why we're here today. We don't want to take away from everything that's happening, but something amazing happened and our audience might not know what happened. What happened yesterday?
Well, it was a very special day. The United States, through our Agency for International Development, was able to present to the ministry, to the government, 4 mobile clinics that will help, we think, to finally conquer the AIDS vulnerabilities that we still have here. As you know, Botswana has already achieved 95, 98, 98 on UNAIDS benchmarks, and we're focused on getting at that stubborn last 522. These mobile clinics will help to reach out to parts of the community that are, typically not served by a very capable public health service here. So they're going to be able to go all over the country to the places where the most vulnerable people are, where people don't typically, in the past, haven't typically accessed, traditional health facilities. Even though in Botswana, which has an amazing record, but even though in Botswana, where we have about 95% of the population within 5 kilometers of a health facility, which is astonishing coverage, it's those last 5% that we're trying to reach. We're also trying to reach people who, for whatever reason, haven't been going into regular, regular health facilities. These clinics, which are going to have a nurse and a counselor in addition to a driver, and we'll be able to go out and do testing and treatment, dispense medicines, do a bunch of other things, will help to bridge that gap.
Well, it's Gabs FM Power to engage your world. I think this is an absolutely amazing development. And of course, this is what us young people do. We celebrate B-Dub, we celebrate the US government. And of course, it goes to show that through collaboration, we can achieve a lot more. Hashtag shared prosperity. Look, Ambassador, let's say somebody just joined us and we're trying to connect the dots. You know, a mobile clinic, what does this mean? It'll be able to drive into remote areas and of course address certain issues. And of course, you know, so how do we connect the dots in that way?
Well, that's a great question, Swift. While many people here have ready access to hospitals and clinic, there's a priority now on that last mile. Those few people who don't usually access regular healthcare facilities. So we're going to use these mobile clinics, community clinics on wheels, is what we call them, in conjunction with the Ministry of Health, to reach out to these last areas and make sure that people have access not only to HIV related activity and healthcare, but to the entire suite of One Health. This is for universal care. I'm sure that the minister can speak about this. It's a vision that is very inspiring, and we think that these community clinics on wheels are going to help to sort of bridge that final gap.
Wow, this sounds absolutely amazing, and well done to the collaboration between America and Botswana for making this very, very possible. 15 years ago or so, you know, HIV/AIDS was a death threat for a lot of people.
Absolutely.
I think, you know, every single family in Botswana in one way or another has had to experience some sort of connection with the level of the fact that HIV has really taken from a lot of families in our communities. And now talking about bringing services to the people, you know, for life to go on and life to flourish. It's an exceptional thing that we're seeing here. Ambassador, is there anything more else that you'd like to add on to that?
You know, I think it's very important for us to help to provide the treatment where it's needed, when it's needed, and in the way that it's needed by these vulnerable populations. I'm talking about, people, adolescent girls and young women, young men, adult men, people who otherwise would be a little bit reluctant to go into traditional health facilities. These gaps are where we think the final 522, those people who aren't aware that they're HIV positive, those who aren't on treatment, and those whose treatment hasn't yet achieved viral suppression. Those are the populations that we think are going to be are at most at risk, and those are the populations that are going to be sort of targeted by these mobile health clinics. So I think it's a great advance. We're delighted that we have 2 Botswana firms that are going to be running these.
Oh,
it's,
nice.
It's Tabelo Pole, as well as a FHI 360. It's going to be their employees. They're all Botswana, and they're the ones who are going to be administering these and running these clinics. So I think it's a fantastic partnership. It represents the kinds of activities that we've been involved with since the government asked us to try to help when we established the President's Emergency Program on AIDS relief just over 20 years ago now.
Absolutely. Well, it's Gabs FM Power to engage your world. And of course, it is important to hear from the voice of the BW government, the voice of the Botswana. And of course, in studio, speaking to the Minister of Health, Honorable Edwin Dikoloti. And of course, he had the absolute honor of officially launching the community clinic on wheels yesterday in Gaborone. And of course, he's been hailed. And of course, his ministry has been hailed for its strong response to HIV and AIDS. And of course, where the community clinic on wheels is going to be located, we will definitely engage him on some of these. Motswadi Waka, welcome to the show yet again.
Thank you very much, Swift.
All right, fantastic. Now we're concluding the month of prayer against HIV and AIDS, and of course non-communicable diseases and road traffic accidents. Coincidentally, we're on a long weekend, Buipuso weekend. Now let's touch a little bit on, NCDs and others. Is there linkage between NCDs and of course HIV and AIDS, and how do we correlate the two, various facets that the Republic of Botswana is facing?
Thank you very much. That's a very good question. And also, with the fact that we are going for the long holidays.
Error.
We cannot divorce HIV and AIDS from the non-communicable diseases, as these two do have a very strong relationship. And the HIV infection, may increase even your risk of having the NCDs. History has taught us, we have seen a lot of cases of cancer associated with HIV infections. And when you look at, all the NCD increases that we have been having of late, you will easily tell that the change in the way we live, the change in the way we conduct ourselves, which is also something to do with behavior. Behavior is also something that goes with the increase in the spread of HIV and AIDS.
Yeah.
So all these, when they put together, you cannot separate them. Usually when we talk about this in the ministry, we say we are at the epidemiological transition.
I like that.
So these two, they cannot be separated.
And it's one fight, and one government is fighting this, both the US government and the BW government. Talk to me, sir.
Definitely, Reddy Koloti. Now let's talk about the mobile clinics. How are they going to be able to kill two birds with one stone? How are they going to be able to do that?
Yeah, thank you very much, Samantha. Because we are headed towards independence, one could just easily say we also had independence in terms of our revitalized primary health care, because this takes us away from the conventional methods of you having your clinics. And like the ambassador said before, with our attainment of the 95, 98, 98, the 522, it's not an easy one to get done. It's always that last mile that is very difficult to really overcome. So we are happy that we are now at a point where we believe that, we need to go out. We need to go and reach those that are left behind. If we don't go out to them, they'll not come to us. And thanks to the US government and the partners for having seen it, necessary to get us to achieve this 100. We're very, very grateful for the good initiative. It's going to reach out to areas in Ngami land. It's going to be taken to Kweneng East.
Wow.
It's going to be taken to Francistown. But it's not only just restricted to those areas. We have picked 4 areas, but we're also very hopeful that, there will be a push to even increase the number of vehicles that we have.
Yes.
But, as and where they will be needed, we will have to really reach out to the people. Like we're saying, we are looking for the 522. And, the 522 is hidden somewhere else. It's not like it's even in those 4 areas. So we really need to go all out to make sure that we attain our 100.
Absolutely. I think that's a brilliant development. And, mobility, the capacity to be able to reach remote areas is such an important, milestone that we've both achieved. Honorable, let me give you this opportunity to share your parting words. And of course, I'll also request a parting statement from the ambassador as well. Allow me to offer you that opportunity.
Thank you very much, sir. Let me first start by really wishing Botswana happy holidays, happy Independence Days. As the Minister of Health, it's during this period where you get your facilities really, filled up and all that. Like you said earlier, with your emergencies, people stabbing each other with knives, your accidents and all that. So I really want to plead with Botswana to also be very understanding. Our health personnel has gone through the West in the last 3 years. So if we can really take care of ourselves now, that will really be highly appreciated. And like we said as well, we can't separate NCDs from what we've gone through in terms of HIV and AIDS. It's during this holidays as well that we should really be picky on what we eat. Because your excessive drinking, your tobacco, your eating everything that you see passing by contributes a lot to your NCDs. So I'll urge them to eat right. I'll urge them to exercise, and make sure that they take care of themselves and they come back in full.
Last question: are you a footballer, Honorable?
I'm a sport administrator.
Yeah. So do you play on and off the pitch?
I play more on an administrative role, so that is what matters most. Because if you don't administrate it, then you're not gonna get your players in order.
I like that. I like that. Thank you, sir. Let me give the ambassador the opportunity to share his parting statement.
Really appreciate that, Swift. I'm delighted to be here with Dr. DiColodi. I'm also want to pass on from the United States, from the people of the United States, from my embassy here, as well as personally, congratulations on Independence Day. I'm delighted to be here. The United States has been a very steadfast partner, not only in PEPFAR and health-related things, but throughout Botswana's independence, and we intend to be here. We are friends, and our friendship is built on shared values. So we are delighted to help here, and we're really delighted that Botswana has succeeded, not only in healthcare, but in general, as a peaceable place that respects the rule of law and is democratic, and the United States is going to continue to partner with Botswana. I am a sporter. I do follow sports, and
nice.
I'm very much looking forward to to seeing the Zebras beat Zimbabwe tomorrow in the football match. And looking forward to celebrating the holiday here in Botswana. And I'm also delighted that His Excellency has given everyone Tuesday off as well.
Yeah,
so it's a 4-day weekend. This is a good thing.
Absolutely. Well, it's Gabs FM, powered to engage your world, and you're on the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM, and of course, hashtag shared health. This is an important celebration as we showcase the power of collaboration between the American people and Botswana at large. We've got mobile clinics with the ability to go right around to remote areas of this country. But before we move along, let me do this.
I don't say.
It's Gabs FM, powered to engage your world. Classic music, Stampore Botswana, taking us to 12:35 on the Stars and Stripes radio show, celebrating health on wheels. What you know about that? I must say, this is such an important development. And if ever you have never experienced a health challenge and living in the remote side, it's definitely a welcome development. And this goes to show the power of collaboration. Now, I'm speaking to a super duper team in studio. Now, this is the team behind all the magic. They're what you call unsung heroes. And I think for the past 4 years, we need to actually thank all practitioners within the health industry, whether it's first-time responders, whether it's administrators, for a job well done. You know, whether we like it or not, the globe just came out of COVID-19. You know, we're beating NCDs. We have a fight against NCDs, and of course HIV/AIDS.
Yeah, definitely, Swift. And it's very encouraging to see the people who get the work done on the ground. So welcome to the studio. It's a jam-packed session today. And I think first and foremost, let's just ask everybody to introduce themselves and what they do in terms of technical. What's your role? Let's just start. Okay, let's start that side.
Are we doing ladies first? No, we gotta do
ladies first.
We gotta do ladies first. All
ladies
the
first.
pretty ladies first.
Ladies
okay,
first.
let me say pretty human beings first.
Okay, good afternoon to the listeners. Here on studio is Ratanang Rati Balisi with USA Botswana. They want me to roll on to the technical as well, so I technically do HIV care and treatment for USA Botswana, but very much also working on the primary healthcare revitalization that the Minister of Health is really passionate about.
Okay.
Thank you.
Okay, thank
Fantastic.
you.
Welcome to the show, Rati.
Should we do ladies first?
Yes.
Okay.
Yes,
and then
all
to
ladies
Ratanang's left, please introduce yourself.
Good afternoon to you and your listeners. I'm Dr. Masiro Gilbert. I work with FHI 360 under the EPIC project, and I'm the Senior Technical Advisor for HIV programs. And professionally, I'm a public health physician and a key population specialist. Thank you.
Great. Welcome to the show, and to my immediate right.
Good afternoon to all the listeners. My name is Dr. Khaone Mapinja. I am the Executive Director for Developile Wellness Centers. So technically, I am doing HIV care, HIV prevention, HIV testing as we know it. Yeah.
Okay.
Thank you.
Welcome to the show. Now I know my status because I'm always passing by that area. And of course, last but not least, the king. He's the chairman of the Beard Gang. This is the chairman and president of Beard Gang. Welcome to the show, sir.
All right, great. So good afternoon, everybody, and happy Independence Day.
Thank you so much.
I go by the name Dr. Chris Obanabi.
Yes.
I'm the Senior HIV Advisor for USAID Botswana. It's really great to be here right now. And I do provide support across the HIV spectrum, also health, primary health care, and anything in terms of the developmental space. So thank you.
Fantastic. Dr. Chris, I think let's start with you. You know, this is a milestone achievement within, you know, the inter-partnership or inter-collaborated efforts between a number of different stakeholders that come together to celebrate this. You know, I call it a clinic on wheels, I suppose,
Yes,
you know,
it is.
and it's such an important conversation to have. If the community clinics are in remote areas, what mechanisms are in place to ensure that they're kept running and, you know, and well-fueled engine, you know, the things that they might need. And of course, your perspective on this milestone achievement as a doctor, as a foot soldier against HIV and AIDS.
Yes, yeah, thank you. Absolutely, yes to that. The biggest need we have for the community clinic on wheels, I call it wellness on wheels, right?
I like that.
Wellness on wheels.
Is that there's a need. So Botswana has been absolutely phenomenal in terms of the 95 big celebrations during this independence. Botswana has been one of the few countries in the global south globally to achieve 95. But that's where the missing populations, the missing geographies, and that's where these mobile clinics or the community clinic of wheels really comes in and meets that need. So they're going to be, integrated in terms of the health service they've provided. And so, you know, you have a nice set of staff, clinicians, first responders, people that will provide care directly. And even if it's in an area that is outside of the current scope, you know, they can link you up to the nearest facility or even provide some health literacy or health education to you. So they meet the needs of the clients, which we feel is the most essential need, and that's the engine room. And then behind that, you know, we've put in a really great setup of operations to make sure that, you know, they can open up the corners of Botswana. Yeah.
Great. I think, did you want to add something?
No.
I wanted to add.
Okay, please add. If
Yes.
you'd love to add on what anybody
Feel
else
free,
said, feel
yes,
free.
absolutely.
It's a conversation.
Right. Because it's a very interesting question. We want to make sure that they keep running
Yes.
and very well like a huge engine. I guess the Rolls Royce, right?
Yeah, I like that.
Yes. So we are going to make sure that in terms of resources, they are well resourced wherever they are. Looking at the human resources.
Yes.
So basically on a typical day, just preliminary, we need to have a nurse in the clinic. We need to have a counselor inside of the clinic and the driver who keeps them moving to places.
Okay.
So that's in terms of humans that need to be there. And in terms of supplies, we want to make sure that testing kits for testing are there. Whatever we use for screening, treatment is in there. We are able to draw blood right in the bush, right in the communities, in the households, and we are able to keep it as a real facility on the wheel.
Yes.
So a wheeled clinic, taking all the resources to places at the right time, the right people, the right places. So they'll keep on going, reaching a young girl out there, reaching a young man out there, and bringing innovation to places that really need it the most.
Powerful.
This sounds absolutely amazing. I think another important question that we should not overlook is the issue of key populations and how, you know, key populations can be recognized and why are they more vulnerable to HIV/AIDS? I don't know who would like to take that question.
Thank you for the question. So like anything else, I mean, if you look into the business, you'll see that there's market segmentation. So you have different people with different needs and you want to target them with what would best address their needs. So similarly, in our HIV response, we know that there are people that are highly affected by HIV because of some vulnerabilities that they have. So for example, if you take children, they depend on an adult to take them to health services.
Yes.
So they are a vulnerable population in the sense that on their own, they cannot access health care. But key populations in general, we are talking about the highly marginalized populations in our communities. You'll find that people whose behaviors are criminalized, they are not likely to go to the health facilities and disclose those behaviors that put them at risk of HIV. And also those that are judged by the communities and our society, they're not likely to go out there, even though they have a clinic next door to them, but they may fear to disclose the behaviors that they're engaging in that puts them at high risk. And when you talk about HIV, we know that it is transmitted sexually. So anyone who does not have the ability to negotiate safer sex, anyone who does not have the ability to be able to access care when they need to, because they fear that they will be judged and they will be treated differently by the providers and also the community that they interact with. These are the people that we call key populations. And if you look at the UNAIDS definition, it's a lot of populations. You have your prisoners there and people in closed settings. You have people who sell sex. You have people who may be in same-sex relationships. And because they do not have the commodities to protect themselves from, acquiring HIV. So those will be our key populations. We have priority populations as well, and these are our young people. And yes, you have seen with the bias 5 that young people, infections are on the rise among young people. And this could be just that when they come to the facilities, our healthcare workers equipped to deal with a young person and understand their needs and not be paternalistic and authoritative on them, such that they cannot express themselves and what their need is. So these are the people that will group and say, these are people that are highly affected by HIV, looking at different things. How are their bodies responding to HIV infection? Do they have the ability to say no to unsafe sex? Can they go to the facility and express their health needs without fear of judgment?
Being judged, yeah.
It's such an important conversation. And of course, Doc, we can't leave you out. I know you're definitely. What is your view on this milestone? And why should Botswana really care about Kanyone? Why should Botswana care that there are mobile clinics? What is their role? Maybe their role through the VDC and communities is to spread the word. What is your take on that point of view? And add on with anything else that is related to the subject matter.
Okay, I think this is, I call it the beginning of an era or an achievement or a milestone, because we have now looked at the needs of the people on the ground, the needs of Botswana. How do we ensure that there is universal health coverage? How do we ensure that each and every Botswana is able to access the same quality of services that they would access in a clinic or in a facility anywhere? Like what Dr. Gilbert has been saying, we have populations that are not free or they don't feel confident to go to the normal clinics. So we are saying, as healthcare practitioners or as healthcare practitioners, how do we reach those people? How do we ensure that we are able to test them for HIV, we're able to put them on treatment and improve their livelihoods? So for me, this is really an important moment or a moment to celebrate, to say, as Botswana, we are going on the right steps. We are taking the right steps to ensure that universal health coverage. Botswana Oko Kapamadi, or whether they're in Gaborone, everyone should be able to access the same quality of services.
Well, it's Gabs FM Power to engage your world, and of course, health is
wealth.
Absolutely.
I think I had another important question. I think we're talking about the mobile clinics being used in terms of looking at HIV/AIDS treatment. Is that the only thing that they're going to be used for?
Definitely not.
Okay.
So they are going to be a one-stop shop.
Okay.
You enter through the door, you get as many services as possible. Talking about HIV itself is going to be an array of HIV services, meaning that Dr. Chris said it at the beginning. If you just need education, you'll get it.
Yes.
If you need to test for HIV, you'll get it. Some come for condoms. Condoms will be there in abundance. We talk PrEP. PrEP is a prevention methodology for HIV/AIDS, so that you don't get HIV infection. You'll have it. In case you tested and then you turn out positive, you shouldn't fret, because we are able to give you treatment right on point and on the spot, whether it's in the bush, whether it's in the community, or wherever place we can be able to give that. If we were to come out of HIV space, or still on HIV, we draw blood as well, and be able to transport this specimen to the laboratories for them to be tested, and then we bring back the results back to you again, with closing all that gap.
Yes.
And so now trying to move just a little bit outside the HIV space. You talk gender-based violence, which is now rampant and a concern for everyone. So the prevention thereof, prevention messages, where to go, who to consult. We have that, but we also offer on the spot gender-based violence response, clinical services. If for any reason you are sexually violated or physically violated, we have healthcare providers who can be able to give you support, whether to injuries, whether it's PEP, whether it's referral, whether it's psychosocial support and counseling. Right on the spot, you are able to get all that. Talk family planning, family planning as well. Those that want to limit the number of babies that they can have, or have it in the move right in there as well. NCD screening, lifestyle diseases, we'll be able to screen and manage them right on spot. So it's going to be an array of all this consortium to meet the needs of the populations out there.
Wellness on wheels. Wellness on wheels.
Yes. Wow. Did you hear that it's a wow?
Yes. Let me give you this. Let me do this.
Wow.
Okay, so let me afford you, Dr. Ratanang, to share your parting statements, and of course we'll do all the ladies, and then we'll end with Dr. Chris as we fast approach the end of the show.
Oh, definitely. So I just want to talk to the Botswana out there. This is coming really at the right time. I'm saying that again. It's one of those innovations that I guess we long waited for. Community clinic on wheels is there and out for us to access it anytime. So we are coming to you, and happy independence, everyone. Enjoy yourself through the weekend.
Thank you so much, Doc.
Thank you. So for me, again, I'll just reiterate what my colleagues have said, that, being able to take the services to the people is going to be the innovation that we will use to close the remaining gaps in our HIV response. Our country has done very well as a high burden country that was almost facing extinction from HIV in the past. We have done very well. We started with people walking on foot from house to house. Now we have the clinic on wheels that is going to, facilitate them to be able to offer more in the community. So we just are urging Botswana out there to say, if they have a need for any health services, the clinic is coming to them. Happy independence.
Absolutely. And of course, again, it's all doctors, huh?
Doc.
Yeah, so this is a game changer. And at Developili, we are really excited. We are very grateful for the support that is coming from the U.S. government. And it's really going to impact a lot of lives. We have been implementing on the ground, and we are really excited to take it to the next step, to bring all the services to all Botswana out there. Wherever you are, just call us and we'll be there to service you. Thank you, and happy independence.
Absolutely. And of course, last but never least, Dr. Chris.
All right, thank you very much. I think my part in short would be a message of hope as we're celebrating this independence, and that is, take charge of your world by taking charge of your health.
I like that. Right. Let me take this caller.
So many nuggets.
Wait. Gabs FM, you're live. Hello.
Good afternoon, Chief Mpoloka and Samantha. How are you doing with them?
And all of our doctors.
Those two doctors or those guests, they're not doing enough to emphasize the importance of protection, because we're heading to the Independence long holiday weekend. Besides, their toll-free number, it seems like it's not working, and they are having a branch or the Gaborone center number is not working properly, but they're not saying about it. I don't know if they've noticed that.
But let me say something. You know, sometimes we only point fingers instead of celebrating people who are trying. At the end of the day,
all what the organization is doing, you are celebrating. Although we are celebrating, if there are some faults, you can't turn a blind eye on them.
No, what I'm saying is today we're celebrating a milestone achievement that we have a mobile clinic on wheels. We will 4 mobile clinics. We will take your recommendations and observation. But I'm saying sometimes it's all about timing. Instead of pulling down, let's pull up.
Criticizing all the time.
You know what I'm saying?
We have to be proud and to be happy and just to praise them for that. That is what you're saying.
Because so let's choose positivity instead of only negativity. The immune system, go up, not down, moving swiftly along, pun intended. Dr. Chris, the floor is yours, brother.
All right, great. So back to this fantastic day where we're celebrating the 57th independence. It's take charge of your world, right? Taking charge of your health. And in addition to that, let's not wait until we're ill, before we go to a regular clinic or we look for the mobile clinic or else. The trick is staying well. Yeah. Right? Staying well and staying healthy. And I think the final thing I'll say here is that in staying well and staying healthy, that's how we're able to radiate. That's how we're able to shine. And that's how we're able to stay black, to stay blue, and also to stay white. Happy Independence Day.
The blue, black, and white republic. Danko, ladies and gentlemen, whether we like it or not, the republic is not a perfect nation. But let me tell you something. Whether you like it or not, we got to celebrate greatness. We got to celebrate this milestone achievement. And before you point a finger, the question is, are you the change you'd like to see? Good afternoon.
Kasani. Power to engage your world is on 97.7 FM.
The Stars and Stripes show was brought to you by the U.S. Embassy.